Hello, people of Facebook, YouTube, I don't really know who's watching this, but I'm going to be experimenting with makeup. For those who know me, you're pretty familiar with me and my eye makeup, and those of you who have not seen me without makeup, well, hello. This is my
That's
face.
Paris Jackson, Michael Jackson's 15-year-old daughter. This video apparently recorded a week ago this past Friday, and then this past Wednesday she was admitted to a hospital. The circumstances of that seem to suggest that there was an intention to harm herself. Verdict is not in on exactly what that was. But coincidentally, on Monday in Washington at the White House, President Barack Obama organized a national conference on mental health. A lot of that had to do with gun violence in recent months, but the bottom line was that we are a country that oftentimes does not acknowledge mental health issues. Good Sunday morning, everybody. We're going to be talking about mental health today. We are not going to be talking about guns and mental health specifically, and we're not going to be talking about Paris Hilton. Paris Hilton, she's 15 years old, as I mentioned. She's a young person. She has the right to privacy for a number of reasons, but the incident and the apparent links to, as I mentioned, the intent to hurt herself, that does raise an issue that we have talked about over the past 20 some odd years with Didi Hirsch, the Didi Hirsch Mental Health Services. Every time there has been an incident like this, we have invited someone to come over and talk to us about all of this. Our guests today are Lyn Morris. She is the Vice President and
Vice President of Clinical Operations.
There you are. There you are. I write it down, and it means I'm going to forget it, of course. And Dr. Curley Bonds, he is the medical director at Didi Hirsch. Let's talk about teen suicide, because one of the things that, for example, if people go to your website, one of the first things that you'll see is the emergency hotline. How big of a problem, Doctor, is teen suicide in this country?
I would say that Lyn is the expert. She has had a lot of experience with suicide, but it's an emerging problem and it's been growing. I would say that it's something that affects all age groups, but teenagers, because it's a transitional time, have a very difficult period sometimes adjusting.
I heard some astonishing statistics the other day, and unfortunately I can't remember, but there's something like 11, maybe 1,100 attempts every day, teenagers trying to kill themselves?
Teenagers attempt a lot more than the average person. So this is why we need prevention and early intervention in teenagers, and let them know that there are resources out there like our 24-hour crisis line that can help them when they're feeling so desperate and so dark that they are thinking about ending their life. It's an incredibly stressful time for teenagers nowadays, so we want to make sure that they're able to reach out for help and that they know there's a confidential, anonymous resource that they're able to reach out to get the help that they need.
Any idea what's going on? Is it a matter of hormones? Is it peer group pressure? Why is that group particularly vulnerable?
Well, I think it's hard to say, because suicide is never just one thing. It's usually a combination of things. Mainly, there's usually a undiagnosed or sometimes diagnosed mental illness that the teen is suffering from and maybe hasn't gotten treated yet. There's lots of pressure now for teens at schools, and with the online bullying and things of that nature happening, and everybody being able to post Facebook and, you know, comments and things of that nature, it's extraordinarily difficult for teens nowadays in that way, because everything they do is out there.
Girls more vulnerable than boys?
Actually, boys die by, men in general, boys, teenagers die by suicide more often. Women attempt more often, so teen girls will attempt more often.
From a diagnostic standpoint, what do we look for?
Well, we think about mood disorders. Those are episodes of major depression, people that have difficulties with sleep, appetite, their energy level. there are certain symptoms that are clusters that we look for to diagnose a mental illness. The most common ones are major depression, bipolar disorder, but in addition, people can have severe anxiety or panic attacks that can lead them to do things that they feel like they can't tolerate living, and they may do something to try to harm themselves. In addition, the more serious mental health disorders, things like schizophrenia or schizoaffective disorder, those are medical terms for people that have difficulty with reality testing, meaning they may hear voices that sometimes command them to do things, or they may have delusions where they think that someone's trying to harm them, or they need to protect themselves. So those are all things that fall within the gamut of mental health problems.
But specifically with suicide, all of those can be factors?
All those can be factors. In fact, different diagnoses have different risks for suicide, but I would say that even people that we don't necessarily know are suicidal, sometimes as a result of stress that can come as having a mental illness, can lead them to that point. In fact, we try to do a best job we can of getting people to treatment, because we do know that if they have intervention with therapy and medications, the risk of them harming themselves goes down considerably.
I've known a few people who have decided to end their lives, and one of the things that has always struck me about all of them was that there was a period of obvious depression, sadness, and then there was a brief period where it seemed as though everything got better. They were all of a sudden okay with the world, and within days after that, they were dead. Is that typical?
It can be. I think with depression, over 60% of people who die by suicide have experienced depression. And oftentimes when people are in the throes of a depressive episode, they're not able and they don't have the energy to follow through on whatever method they're going to use for suicide. However, when their energy starts lifting a little bit, that's the dangerous time. And that's the time that caregivers and mental health professionals and family and support systems need to be aware and make sure that they're monitoring them, not just when they're down, but even when they're coming out of the depression a little bit.
So all of these are difficult things to, first of all, recognize, but then there's a degree of reluctance to even acknowledge that, to admit to oneself or to one's friends, family, that you're feeling like this?
Absolutely. We know that 60% of Americans who have a mental health problem don't get treatment, and the people who have problems are about 1 in 20. So it's really a serious, difficult illness to have because of stigma. Many people don't seek treatment because they're afraid of being ostracized or being treated differently. Some studies have shown that even healthcare providers can treat you differently if you have a serious mental illness. There's also the idea of going back to the community, having family pull away or be overprotective, so people often don't seek help because of it.
The stigma is strong with mental health, and we see it all the time, and especially in certain cultural backgrounds too, where they don't reach out to mental health professionals because there's so much shame and so much stigma around that. And it's sad because there is treatment out there. People can recover, people can get better, there is hope, but they have to access the services to be able to get better.
You've touched on something that we were actually going to talk about later, but we might as well do it now since we're here. And there are so many different cultures here. We're not just a melting pot, we're a salad, however you want to put it. But I would imagine there's particularly in ethnic communities, that there are generational problems. The parents who might be the immigrant generation, totally unaccustomed to acknowledging mental health issues, and yet they have American-born kids who are more aware of that, but they're caught between family and the surroundings, the neighborhood, the peers.
Definitely, the desire to blend in is true across humanity, and it's true across age groups. Within families, we do see that there may be language differences. Kids that have adjusted and acclimated, they're acculturating, and sometimes they'll want to be more part of the community at large, whereas their parents may want to maintain more traditional values, and that can create some tension. I know the minority community that I work closely with is the African American community, and often there can be a component of feeling as if having a mental illness or admitting it can be a sign of weakness, and people are much more likely to talk about feeling low or talk about their physical ailments as opposed to addressing the mental health problems that often underlie it. And I would say this is true through a lot of minorities of color.
And how does one get those people who want help but are afraid to seek it. How do you get them? What does it take to get them to crawl out of that and get some help?
Well, a part of it is meeting them where they are. At our center, we provide services that are field-based, meaning that we don't just sit at the clinic and wait for people to come to us. We have teams that work with intensive outpatient services, so they'll meet you at home. I think with younger folks, going to the schools where you can educate parents and teachers. We have school-based programs, so it's really going to the communities where people are from, and a large part of it is having providers who look like them and speak their language.
Before we take a break, but I know you don't walk around with a crystal ball saying, oh, the guy over there in the Panama hat, he needs help. Somebody either has to let someone know that they need help, or they've got to figure out some way to make the first move.
Right. Well, one of the big changes that's happening now in healthcare is that we're integrating physical and mental health together. We're doing integrated programs where one sees a primary care provider who does a screening. It could be as simple as 2 questions about mood, or a longer evaluation where they can then refer to mental health.
Okay. We'll talk more about that when we come right back. Stay with us, please. For more information about Didi Hirsch mental health services, there's a phone number and a website. The phone number is 888-807-7250. So that's a free phone call. The website, which is completely fascinating, is www.didihirsch.org. You can spend half an hour, an hour there just clicking your way around the website. Amazing amount of information. Whether or not you feel a need for help, it's just a good place to go look and learn a little bit more about the world that we are living in. You can also, if you are, I'm not sure what the word would be, but if you are in urgent need of someone to talk to, the Suicide Prevention Crisis Line, 877-727-4747. There's someone there who will be able to listen to you, help you in any way appropriate for that during that phone call. I urge you, and I have known people who have called that number, I urge you to call it if you have any sort of a need to talk to somebody. We'll be right back. This is Midday Sunday. We're talking today about mental health issues. Our guests are from the Didi Hirsch Mental Health Services. On the left is Lyn Morris. She is the Vice President of Clinical Operations at Didi Hirsch. And on the right, Dr. Curley Bonds. Also, you're the medical director there.
That's correct.
Okay. So we hear this generalized term, mental health, but then we also hear things like paranoid schizophrenic, or on and on and on. There are many different, what do we call them? Mental illnesses out there?
Right. The current concept is that mental health disorders are brain diseases, and we know that they come in different clusters. There are mood symptoms, there can be anxiety disorders, and there can also be psychotic disorders, which are thought to be the most severe. And within those different categories, there are subcategories of illness, and we've recently revised how we classify them. In fact, every 10 years or so, psychiatrists meet based on research, and there's a diagnostic and statistical manual that guides us through what a person has. But about 1% of the population, say, is affected by schizophrenia. About 20% of people will have a mood disorder at some point in their lives. So the staggering numbers are that the vast majority of us either will have or know someone who has a mental health problem during our lifetime.
Do these tend to be some sort of chemical imbalance, or is there a physical component to these?
That's a great question. We use the term chemical imbalance to sort of tame it so that it doesn't sound too scary, but most of these disorders are biological, psychological, and sociological. For example, stress from job loss or discrimination can be the psychological or social component. If someone has economic distress, then they're more likely to have a mental health problem. But there are those illnesses that are created by trauma. For example, veterans who serve in the military that are exposed to things that are life-threatening are more prone to have mental health problems. But at all of these, there may be some genetic vulnerability that leads to the expression of a gene.
What about circumstantial or environmental issues? Can breathing a lot of smog, for example, make one more vulnerable to some sort of imbalance or illness than others?
Well, I can't speak for smog, but let's just take the example of cancer. Someone who smokes and develops lung cancer has difficulty breathing. One of the worst things they're going to experience is anxiety from not being able to catch their breath. Most of the physical health problems that people have will be combined with some type of psychological component. The fear of dying from a chronic medical condition can predispose to depression, and there are also things that we know, like strokes, that affect specific parts of the brain that may then lead to various mental health problems.
As a marriage and family therapist, does this require treatment of these? How often does it require medication versus talk therapy?
Well, I think the best combination of treatment is a combination of therapy and medication for most people, but it's very individualized, and that's where people need to speak to a therapist, speak to a psychiatrist, go in for an evaluation and let them know what's going on so that the best treatment can be determined of what's going to help that person. Curley could speak to the medication, but I know therapy does work. It's obviously my field, but I've seen it work. I've seen with at Didi Hirsch, we run a group for people who have attempted suicide, and just having that support and people knowing that they're not alone in this and that they have support from others and they're learning coping skills and learning ways to keep themselves safe is giving them the tools that they need in the future to continue living.
I'm fascinated by the thought of a group setting for people who have attempted suicide.
It's quite unique. There's not many of them in the United States, and Didi Hirsch has taken a lead on facilitating this group. We heard the community. We were getting many calls from family members saying, you know, it's great that there's a crisis line out there. We can call when my family member, when I need support or they need support and they're in a suicidal crisis, but what do we do with all the time in between, and how do we help them so they don't have to call the crisis line? So we developed a group for people who have attempted suicide. It's an 8-week group, and it's led by a licensed therapist, and eventually will be led by somebody who has attempted as a peer facilitator, because we believe in that model and involving others to show that they can get better and that there is help. And it's a fascinating group, and it's a group that has really helped many people. We've been doing it for over 2 years at this point.
Since Lyn mentioned it, what about the medical side of treating some of these illnesses? Are we talking about tranquilizers, or what are we talking about here?
Well, there's a large diversity of medications, and as a psychiatrist, my role is to figure out, first of all, if the person is willing to take medication, because that's always a choice. Figuring out whether it's a mood disorder, in which case one would generally give either an antidepressant or a mood stabilizer, or if someone has true psychosis, meaning the voices or visions or delusions, then we'd give an antipsychotic. We're learning more about brain chemistry, and we've figured out that some of these categories are at best marketing categories. For example, an antidepressant may also affect your anxiety level. We do know that some of the drugs that we previously thought of as being major tranquilizers or antipsychotics can help to stabilize mood. So it's really important to work closely with your doctor about, first of all, which medication, making an informed decision based on what side effects you're likely to have. But for a large number of these medications, the response rate is quite high, 70% or more in the case of, say, antidepressants.
But some of these mood-altering medications, it's common to hear a warning or read a warning saying if you have thoughts of suicide. Something's off here.
Well, what we've learned is that people who take these medications generally don't start out from a place of being healthy. So there may be some problems that the medication doesn't address, but we do know that certain antidepressants, for example, can increase thoughts of suicide. It's been rare that there have been completed suicides from taking medication, but you really have to weigh the risks versus the benefits. And we do know that prevention as a strategy with medication far outweighs the risk of someone doing something if they're not medicated.
As a therapist, what's it like when you suddenly realize that one of your clients is having a breakthrough?
It's one of the best experiences you can have, knowing that this person is finally feeling safe enough to get the help that they need. They're feeling that hope, and they're talking about it, and they're able to get the help, because unfortunately mental health is so stigmatized still in our communities, and we want people to reach out for help, whether it's veterans coming back from war, whether it's families, homeless adults living on the streets. Didi Hirsch provides services for a variety of people, and there is help.
We will talk just a little bit more about the services provided to Didi Hirsch, but we need to take a break one more time. We'll see you on the other side of that. For more information about all we have talked about, it's also a place where you can make all kinds of discoveries. You should go to the website, first of all, for the Didi Hirsch Mental Health Services. That website is www.didihirsch.org. There's a phone number there. It's a toll-free phone number, 888-807-7250. And for the Suicide Prevention Crisis Line, that number, 877-727-4747. You can also find all of these on our website, which is myfoxla.com. We only have about a minute left, but what should people come away from this program knowing?
I think the big message is that most people with mental health problems can and do recover. And getting help is the first thing. Prevention goes a long way towards decreasing disability and distress from these problems, and people just need to reach out.
The youngest child that you've ever treated?
We have a 0 to 5 program at Didi Hirsch where we will serve clients from birth all the way to older adults. So we do it all at Didi Hirsch.
And I suspect that there are people who are astonished to hear that children that young are presenting with some indications of things not being right.
People can be surprised by it, but that's why we need to talk more about mental illness and reduce the stigma out there, to know that people can get help if they talk about it.
Yeah, and that's bottom line is you got to get some help. You can't live your life trying to cope with all of this.
Right.
To both of you, we thank you for being with us today, and to all of you, we thank you as well. We'll see you back here same time, same place.